For patients with aortic stenosis, transcatheter aortic valve replacement, or TAVR, could be a very good option. How is this procedure being done? First, it's most different from traditional procedure is without open heart procedure. Valve will be mounted on a delivery system, which will be prepared in the operating room because of different size. It will be crimped on this ballooned area in the operating room. This large sheath will be inserted through a tiny incision at the femoral artery or the groin region. And then this catheter system will be traversed through the femoral artery abdomen all the way to the left ventricle aortic valve position. Once the position is verified under the X-ray and transesophageal echocardiogram, an inflation device will be hooked up to the delivery catheter. And once we then appropriate pressure and the volume will be applied to this delivery system, the valve will then deploy and will be sitting in the aortic valve position and will be functioning appropriately as a normal aortic valve.